Thank you for joining us today. This is our June 12th Healthcare Workforce Committee educational webinar. I'm Rebecca Donnell. I'm the Primary Care Office Policy Lead, and my pronouns are she, her. I'll be facilitating this morning. I'm glad you could join us for our presentation this morning on job growth in healthcare and future workforce needs. A little bit of housekeeping this morning before we jump in. We are recording the meeting this morning so that anyone who wasn't able to join us live could access the recording and listen to it. And it'll be posted on our website. If everyone could please, when you're not speaking, keep yourself on mute just to keep background noise at bay. If you do want to speak, please use the hand raise function and we'll call on you for questions. You can also put your questions in the chat and we'll be monitoring the chat throughout the presentation. And with that, I'd like to introduce our speakers this morning. We have Gail Krumenauer from the Employment Department. She joined the Employment Department in 2009 and currently serves as the Oregon State Employment Economist. In the role, she focuses on industry trends across Oregon and current labor market issues affecting workers and employers. She has throughout her career worked in private, nonprofit, and government organizations and earned her master's degree from the University of Wisconsin-Madison. Joining Gail, we have Jason Payton, who is currently the occupational economist for the Oregon Employment Department. He's been a researcher for the Workforce and Economic Research Division for more than 16 years. His work has included collecting employer data on behalf of national occupational surveys, studying the construction sector, as well as long-term occupational employment trends, and leveraging labor market information for different audiences. So welcome, Gail and Jason, and I'm going to hand it over to you.
Awesome. And I think someone else is running the slides from the other end, correct?
Yeah.
All right, if we can just skip right into slide 3, that would be awesome. Good morning again. My name is Gail Krumenauer. Happy to be here with you to talk about job growth in healthcare and future workforce needs. As we skip right into slide 3, I'm going to start with laying a landscape of kind of where Oregon's labor market is, looking first at what job growth looks like, some trends in employers' current hiring needs, and then in future hiring needs. And I'm happy to be talking to a healthcare group because a lot of times these conversations when I'm speaking to manufacturing or other groups aren't quite as cheerful. So let's go ahead and get started. Oregon employers added 4,900 jobs in April. What you're looking at here is monthly job change in Oregon over the past 2 years. And what we can see is that over the past year in particular, job gains have slowed in Oregon. And overall, Oregon is actually one of the slower job growth states in the nation right now. We added 4,900 jobs in April, and over the past year, we've added 16,100 jobs, which by historical standards is relatively slow growth. That's less than 1% over the year. Monthly job gains have averaged 1,200 jobs so far in 2024. And a year ago, it was almost like in 2023, it was almost double that. So if we move to the next slide. Taking a bigger look at what's happening in all broad sectors of Oregon's economy over the past year. As I mentioned, we've added 16,100 jobs over the past year. Private healthcare and social assistance alone has added 16,600 jobs over the past year, which is a growth rate of nearly 5%. And yes, is more than the overall economy if you take all of the other industries and add them in as well. And so private healthcare and social assistance, along with local government, is pretty much carrying Oregon's economy right now. And that's because you can see as you look towards the bottom of this graphic, all of the industries that have lost jobs over the past year, in particular manufacturing, retail, trade, and professional and business services. But we're seeing smaller losses in other areas too, like construction, financial activities, and leisure and hospitality. So just pointing out how strong the growth has been in private healthcare and social assistance over the past year and relative to all other industries. Now, one disclaimer that I think is always important to make is just because healthcare and social assistance is growing like gangbusters right now, that doesn't mean that we're meeting all of the healthcare need that exists in our communities. It just means we're seeing really strong growth. As we move to the next slide, I wanted to emphasize just how strong that growth is. Now, if we kind of ignore this little, there's an administrative blip right in the 2017 window where there were a bunch of home care workers that used to be classified in government that got moved over to the private sector. So you see this big level shift up in healthcare, but the line has, you can see over the course of time, healthcare and social assistance is a large industry that tends to grow regardless of economic conditions. There are other industries that you'll look at, and when the economy turns down, they turn down. Private healthcare and social assistance has continued the upward march for the most part, with the exception of this period of flatness during those large COVID waves in 2021 and 2022. And you can see, we used to say it kind of looks like a 45-degree angle just straight up over time. That's actually strengthened, and we're seeing even stronger growth in recent years than we have historically over the past few decades, which I think is at least partially attributed to making up for some of that period of flatness that we had. And then also just the demographics where, you know, an aging population and aging workforce. And as we get into those older years of our lives, we tend to have more healthcare needs. Just looking on the side, wanted to point out that it's not just one area of healthcare that's growing. We are seeing growth across all major areas of the healthcare sector. Ambulatory healthcare services, which is doctors, dentists, specialist offices, have added 2,800 jobs over the past year. Hospitals have added nearly 3,000 jobs. Nursing and residential care facilities have added more than 3,000 jobs. And social assistance, which is a variety of different things. It can be childcare. What most of the growth has been over the past year is in individual and family services. So like services for the elderly or those with disabilities. And that's where we've seen the largest number of jobs added in healthcare over the past year at 7,500. Switching to the next slide. So that's kind of where a look at where the sector and where Oregon's labor market is in general. I want to switch to taking a look specifically at some of the needs that employers are telling us they have within the sector. Just to set the stage broadly first again, Oregon, we're one of just a few states that run their own private job vacancy survey. So each quarter we ask private employers how many job openings they have, a sample of them, not all of them, how many job openings they have that they're actively recruiting for. And then they tell us information that we can't get any other place otherwise, like what share of them are full-time, what share are permanent, what require previous experience, and how many are difficult to fill, and the starting wage, which if you go and look out on different job boards, a lot of times you'll see is missing. And we get that for more than 80% usually of all the vacancies that we get back. So just looking at the winter of 2024, anytime from January to March, there were 60,300 job vacancies. In historical context, that's coming down. We were at a period in 2021 and 2022 where we were at record high job openings, about 100,000 at any given time for a year and a half or so. So we're far down from that, but still, this is an incredibly high level of job vacancies for the winter when we tend to see the lowest level of the year, and not too far off of the record before the pandemic recession, which was 67,000 job vacancies in the summer in 2017. The typical job vacancy is for a full-time permanent position. About 2 out of 5 require education beyond high school. And one thing that if I don't harp on this later in the presentation, I'll say now, is that even in what have been considered pretty difficult hiring conditions for employers, a majority of all job vacancies require previous work experience. And that's one of those things that can set up, like an added hurdle that job seekers need to get over to be eligible for a job vacancy. And in some cases, that's for health or safety reasons, particularly often in healthcare, but can create an extra difficulty for employers that are hiring when those workers could get a similarly paying job without those extra credentials or hurdles that they need to cross. Next slide, please. This is just taking a look at, so this is if we're comparing the number of unemployed people in Oregon and in the US to the number of job vacancies that are out there. I'm trying to demonstrate here the level of tightness that's in the labor market. So how hard is it for employers to fill all the jobs that they need to fill? Because private healthcare and social assistance has added the most jobs and also has the most job vacancies, has been accounting for about 1 out of every 3 job openings in Oregon's economy. And so there's this tightness in the labor market where even though the number of job vacancies has come down and unemployment has risen a little bit, these lines that you're looking at is how many unemployed people are there for every job opening out there. And in the US, we're still in a situation where there are more job openings than there are unemployed people. So even if every unemployed person perfectly fit into a job opening that was out there, you'd still have more job openings left over. Now in Oregon, that's eased up just a little bit as job vacancies have come down and unemployment's come up just a little bit, but not so much that it's meaningfully easy for employers to fill all the job openings that are out there. You still have about 2 unemployed or 3 unemployed people for every 2 job openings that are out there. As we move to the next slide, as I mentioned, the 60,300 job vacancies in the winter, the bulk of those are in private healthcare and social assistance. So even though the sector has been adding jobs at a relatively rapid pace, there's still plenty of advertised need that employers have. They're looking for more workers. And as I mentioned before, healthcare and social assistance alone accounted for almost 1/3 of all job openings in Oregon at any given time between January and March. Switching to the next slide. Uh-oh. Oh, there it is. Oh, good. For some reason, I was like, we almost skipped one. If we look at the next 12 months, I wanted to point out that just in the short term, the Office of Economic Analysis does projections for what we expect to see in the future. Expect us to see about 22,100 jobs in the next 12 months. They expect healthcare to be near the top of the list of job gainers over that time. Bringing that into what types of jobs, the current need that employers are trying to fill. Here's a list. To get into occupational detail, we have to use a whole year's worth of data, which is why you're looking at 2023 here instead of just the winter of 2024. And as I mentioned, the number of job vacancies has come down a little bit, but at any given time in 2023, it was just a little bit higher than in the beginning of 2024. It was about 73,000 job openings at any given time. And just looking at the healthcare ones, looking at those that have the largest number of hard to fill job openings, and we can talk in a minute about what that means. But the ones that rise to the top are, and these were the largest ones before the pandemic recession too, so it hasn't changed, are personal care aides, registered nurses, and nursing assistants. What I see now is that there's a deeper list of healthcare occupations, healthcare and social assistance occupations that have larger numbers of hard to fill job openings. So stretching beyond the typical 3 that we would usually see, there's also medical assistants, dental assistants, mental health counselors, social and human services, physical therapists, rehab counselors. So the list is deeper now than it has been prior to the pandemic recession. But at the kind of top line picture, we still see healthcare has the largest number of job openings. That's consistent over at least the last 10 years. And the largest number of hard to fill job openings. That's also consistent over at least the past 10 years. Next slide, please. And we also expect private healthcare and social assistance to lead growth in the future. We are looking here at the number of job openings that are projections. So we do the long-term 10-year projections. We expect that healthcare will add the largest number of jobs uh, between 2022 and 2032. And what you're looking at here in the graphic is the difference between the growth, where we expect there to be a little less than 5,000 new jobs from growing or expanding businesses annually in healthcare and social assistance. That lighter bar that goes all the way out past 35,000, that's the total number of openings we expect there to be in any given year. So we have the ones that are from growth, that smaller, darker bar, from new or expanding businesses in Oregon, and then all of the other one, the much larger number, that portion is due to replaced workers who are retiring or otherwise leaving the labor force. And we know that healthcare and social assistance is particularly, as we move to the next slide, I shouldn't get ahead of myself. So things that could affect the future growth that we're projecting, we know that healthcare is one of those sectors that has the largest number of workers who are 55 and older who could be looking towards retirement in the next decade. So that only kind of exacerbates the need to be able to replace them with trained workers, which you're slightly more likely to need some sort of credential beyond high school for a healthcare job, just on average, than for another job in Oregon's economy. So if we're looking here, we see that there's about 456,000 jobs that are held by Oregonians ages 55 and older. In the early 90s, it was about 1 out of 10 jobs that was held by a worker 55 and older. Now it's about 1 out of 4. And within that, you'll see healthcare and social assistance has the largest number, almost 70,000 workers who are 55 and older. And actually, that number is down a bit if you look at the prior year's number, which that's still in the 2021-22 kind of, I don't, not that there's ever a typical time, but it was a little bit more turbulent of a time, I think, in healthcare than some other sectors of the economy. So we might be on the leading edge of seeing that number going down, because we are actually seeing those people moving into retirement. Yeah, I won't focus on the other sectors. We can talk about them if you want to. Manufacturing is another one that has a large number of workers who are 55 and older that are also maybe looking to retire in the next decade. Switching to the next slide. So other things that could affect future growth. One is that we're seeing slower labor force growth. So what you're looking at here is, so in addition to aging workforce, we also have slower population growth and slower labor force growth. And we'll talk about the population in a second. But since the mid 2010s, we've seen labor force growth drop off notably. And so again, this isn't a thing that was happening before the pandemic recession, but we've seen it stay kind of lower just in the run up to and now kind of afterwards. And so as we're seeing more workers aging, we'll talk about retirements in a second. We're also seeing slower labor force growth, and that puts a risk on the growth potential in healthcare and in other sectors of Oregon's economy. In 2023, the labor force growth was the slowest we'd seen, with the exception of years that are like bound right around a recession. So next slide. As I mentioned, in addition to the aging workforce, we're also seeing that in 2023, Oregon had a record number of folks who said that they were not in the labor force because they were retired. That number hit an annual all-time high in 2023. That's another one of those factors that could limit potential future growth. And the last piece of this layer cake on the next slide that I'm making of potential things that could inhibit growth is, again, underneath the labor force piece, there is also slowing population growth. So one of the ways that Oregon has been advantaged over the past 4 decades has been that ever since the mid 1980s, we have added population every year. And the majority of the way we do that top bar that's much larger and orange, is net migration, people moving here from other states and other areas. And so that's been an advantage for us that's allowed us to grow to have stronger job growth than the nation over the course of decades. Again, you can see that this was eroding a little bit in the mid 2010s prior to the pandemic recession. And then we saw the growth turn negative. For the first time, we actually saw the population decline in 2021. So that was the first time in pretty much a generation. And we're expecting slower population growth going forward. And again, that feeds that slower labor force growth and becomes one of those things that could otherwise alter what we expect to see in terms of future job growth heading into the 2030s. Next slide. Uh, Wanted to hit on unemployment as another piece of this as well. So as we transition to thinking about like, what does this mean for employers? If you're in a period of time where you still got a relatively large number of job openings, which we do, and you're seeing slower population growth and an aging workforce that's increasingly moving into retirement, you pair all of that with low unemployment, meaning most everybody that wants a job has a job. And that becomes a really difficult position for employers to be in. So continuing that tightness I was talking about, where it's hard to find enough workers to fill all of the job openings that you might want to fill. And so this is just kind of proving the point that we are also still in that low unemployment environment. It's drifted up a little bit, but over the course of the past 4 or 5 decades, it's fairly rare for Oregon's unemployment rate to be at or below 4.5%. And that is where we are right now. We're at 4.2% in April. Next slide. This graphic has a ton of stuff on it, and I'm not going to spend a lot of time parsing out. The point to see in this graphic is that the lowest bar here is for any given county or area of Oregon. The lowest its unemployment rate has been since at least 1990. The highest bar, the top one, is the highest it's been since 1990. And the dot is where it is right now. So low unemployment, the point to make here is low unemployment isn't just happening in one part of Oregon or in metropolitan counties or in Eastern Oregon. It's happening across the state. We are seeing relatively low unemployment happening across Oregon. Next slide. So we're thinking about, again, about trying to find enough workers. One of the ways that when you're in this low unemployment environment and you've got maybe slower population growth happening is to think about increasing the participation among the folks that are already in communities, right? There's some folks who maybe aren't participating in the labor force. They have family or other obligations or, are focusing entirely on school or their education as opposed to doing that and working at the same time. What we see is that labor force participation is actually relatively strong in Oregon. It's the highest it's been in about a decade. So we are seeing strong labor force participation, finding other ways to strengthen that labor force participation more could help increase the labor pool that's available if we don't see population growth resume in a really meaningful way quickly. And again, as we move into the next slide, just wanting to highlight that while we do see low unemployment all across the state of Oregon, labor force participation varies widely. So we're seeing, there's pretty low unemployment all across Oregon. That looks pretty uniform. This is much different, where you can see that unemployment or labor force participation can be as low as less than 50%. So labor force participation is anybody who's 16 and older who lives in a particular area. They're either employed, and that could be working for yourself, working for a payroll employer, working on a farm, sitting in Bandon and working remotely for a company that's in Montana or something like that. All of those forms of employment count. Either you're employed or you're not employed, but you're actively seeking work and available and able to take a job. So within the last 4 weeks. So you're in one of those two categories. And so that share, the lowest in the state is in Curry County, 44%. And a lot of that can be due to demographics in an area as well. The age and the demographics of an area, are there more retired folks there, things like that. Where you see the highest labor force participation at about 75% is in Hood River County, and in a couple of the Portland metro counties are pretty close to that too. So there's wide variation as well in terms of labor force participation. And I wanted to highlight that because that creates different challenges in terms of labor force engagement for different areas of the state. All right, next slide. I'm almost done. I've only got 2 left. So again, all of the things that I've kind of been driving at and talking towards are hit on kind of like our growth potential. And I think, given the prominence of healthcare, it's something to think about more broadly because that's really what's driving things right now too. Um, when we look at, like I said, the past 20 years or so, you can see that Oregon, that top blue line, has overall stronger job growth in its pace over that time than the US. And again, that's attributed to a lot of those population and labor force, things that I've been talking about throughout, and continued strong employer demand for workers. But if we switch to the last slide that I have, you can see that from 2020 on, the trends reversed. So in this time where we're seeing slower population growth, slower labor force growth, and all these things, Oregon's actually lagging behind the US in the past 4 years in terms of our job gains during a recovery and expansion period. So that's something that is a trend that's different for us right now. It's something that we're keeping an eye on, and we're seeing how things might rebound or change in the coming months and years. With that, I'll pause to see if anybody has a question, and then we can hand it off to Jason. Right, Jason, I think it's you.
All right, thank you, Gail, and members of the committee. Again, good morning. Let's go ahead to the next slide and start talking about the impacts of some of this trend in healthcare and across the state in terms of Oregon's workforce and population, and how that impacts future workforce needs. The Workforce and Economic Research Division, the group that Gail and I are part of, are kind of uniquely and kind of strategically placed in a world where we have access to a lot of fantastic information. So the trend in employment in healthcare and across Oregon that you see is coming from national surveys that many of our staff actually participate in, collecting information for. We have access to unemployment insurance tax information from over 180,000 businesses here in Oregon. So we have a very accurate idea of what's going on in healthcare, as well as all the other sectors in the economy when it comes to employment levels and employment trends. And because we have all this historic data, we can look back over decades to see the overall trend of how employment is changing over time and apply national factors and national inputs to sort of get a sense of how things are going, how that aging population is going to impact workforce needs in healthcare, as well as other sectors in the economy. So let's start off with the big headline item. Over 2.6 million job openings are projected over the next decade, essentially between 2022 and 2032. And as Gail had alluded to in the previous chart, showing those openings from growth versus other openings that we're projecting, um, those are a lot of job openings coming from industry growth, the expansion of Oregon's economy. Those are great things for Oregon families and the vitality of our state. But from a workforce needs standpoint, from uh, a degree standpoint, from an employer human resource standpoint, that's not all we have to account for. The reality is that job openings come in many different flavors. And if we go to the next slide, we'll see that these openings come in hundreds of different careers we have to account for. So if we're talking about registered nurses, we have to account for nurses that change careers. Maybe they've been promoted. Maybe they've gone through the pandemic and frankly burned out from their experiences and had to change careers. That creates a job opening that has to be filled by a highly skilled licensed individual that's ready to go. We also have people, as we have an aging workforce that healthcare is certainly is exposed to, those folks at some point want to retire. They want to take long walks over at Seaside and maybe check out South Sister. And when they head out and retire, those job openings has to be filled as well. And they account for the vast majority of openings that we see and project over the next 10 years. When it comes to growth, as I said, it's a vitally important for Oregon's economy to see growth. There are some parts of healthcare and healthcare related occupations you're going to grow a whole lot faster than the rest. And that's where, putting things into context, being able to compare some of the numbers that you see either from us or out there in the wide world of media, it is important to put that comparison of apples to apples to get a sense of exactly what that growth rate means. So in the case of Oregon's growth rate, the current projected growth rate between 2022 and 2032 is just over 10%. So we're expecting the overall number of jobs in Oregon's workforce to increase just over 10%. Now, healthcare, as Gail has talked about, is going at a much stronger clip. You know, it was Thomas the engine. It thought it could, it thought it could. It's always going up the hill. We just set a straight line with a ruler and called it a day. That generally is still the case. You know, that has been impacted by the pandemic. Some of our projections are going to still show the recovery of some sectors of healthcare coming back to sort of norm. And so that's something that we have to be prepared when we're looking at these numbers. But from a sector standpoint, areas like hospitals, which are a little bit more driven by population, is projected to grow at a slower rate than healthcare as a whole, about 7%. The healthcare sector as a whole is around 15%. And sectors that are still kind of getting back from the pandemic, like nursing homes and assisted living, where they had a hard time filling back a lot of those positions that they lost. Well, that's closer to 21% growth rate as an industry. Now, within that industry, we have hundreds of different careers that workers could possibly work in, ranging from healthcare practitioners, healthcare support occupations, to the IT worker or a food service worker hanging out in the hospital's cafeteria. All those jobs count, and we have to be aware of those and the needs to fill those, because without the entire system of workers there and available, we can't provide the quality of care we want to provide to our patients and our fellow Oregonians. So when you look at individual occupations and their growth rates, this overall dynamic of recovery and change in the delivery of services, the advancement of medical technologies, is playing into these numbers a little bit. So our fastest growing occupation, nurse practitioners, is driven by the expectation by us and the US Bureau of Labor Statistics that the delivery of medical care, essentially your frontline work as someone comes in with a cold or a flu, is going to be shifting more away from our conventional general practitioner or family medicine medical doctor to a nurse practitioner, registered nurse, or some other occupation that has the proper licensing to provide that service, but maybe not necessarily that historical, conventional expectation of the doctor checking out and applying treatments. Other occupations in here where we're seeing faster growth, like medical assistants or physician's assistants. Again, that's driven by a general sense of where things are going in terms of the treatment of medical services and treatments. And for occupations like home health care and personal care aides, where those are more found in assisted living settings, that's more driven by the recovery of that sector as a whole as employment sort of gets back to the historic norm. Let's go ahead to the next slide. Oh, and we had a question in chat. Will the recording be sent out via email after this webinar? Rebecca, you want to chime in on that?
It'll actually be posted on our website.
Okay.
Yep.
All right. Thank you, Rebecca.
Thanks.
All right. So one of the other sectors that I want to highlight, because this has been a really strong point of interest by the state, by legislative initiative, and by those in the front line, is behavioral health in Oregon. And again, just to put that into comparison in terms of our expectations, we believe that the focus and interest in serving people who have behavioral health issues that need these services is of focus right now. We expect that to continue to be the case. And as such, the overall projection is kind of trying to feed into that expectation that resources are heading that direction in terms of adding more behavioral health care workers in Oregon. And as a result, while Oregon's overall industry occupational growth rates are closer to 10%, if we look at occupations in behavioral health related services, that's closer to 15, 17, even 20%. So that's kind of baked into some of the numbers that you'll see coming from our division and our projections economist. Let's go ahead to the next slide. And so again, just as Gail had showed the industry perspective of job openings and projected job openings due to transfers and exits, we can also have that same perspective occupationally and look at some of the largest industries and set occupational groups and see how those job openings are going to change over the next 10 years. So one of the things that we have to be aware of is that entry-level jobs in whatever sector we're talking about typically have fewer barriers to entry from an educational attainment standpoint. They typically pay lower wages. And as a consequence, they're great starting positions for a lot of workers, but typically see a lot of high turnover. High turnover relates to and directly ties to higher job openings. And so from an occupational standpoint, when we talk about job openings in Oregon, the largest number of job openings we're going to find are in areas like retail jobs or food service jobs. But not to discount the healthcare sector, our practitioners and our support workers, we're still talking over 230,000 job openings in healthcare practitioner and support jobs here in Oregon, projected over the next 10 years. So while there's a lot of job openings in other occupations and careers, there are a lot of job openings projected in healthcare between 2022 and 2032. Just a little bit of background and context in terms of how we come up with these numbers. The reason why we focus in on these replacement openings, this other area other than growth, is the fact that when we look at national trends and national surveys of workers and ask the question, you know, are you retired this year and what job were you in last year? We get a sense on an annual basis how often people actually leave that career. These national figures developed by the US Bureau of Labor Statistics actually estimate a probability function and basically a measure of how likely it is a worker is going to leave a particular career based off of their age, their gender, their education attainment level. You know, if I'm a barista with a bachelor's degree, do I really want to stay in that job? There might be some frictions tied to certain occupation groups and education attainment levels, the industry that I'm working in, and a couple other factors to get a sense of how often someone either leaves the workforce or actually changes careers altogether. For instance, if we look at the current population surveys, supplemental March survey from 2023, nationally speaking, registered nurses had a retirement rate of somewhere around 2 to 2.5%, which is actually slightly higher than the national average. So as a national trend, there was a bit of a higher retirement rate with registered nurses. Part of that is the fact that we have a higher average wage and a higher number of workers in healthcare, as Gail talked about, that are working in healthcare. And so we might expect to see some of those numbers be a little bit higher than the national trend as a whole. The other factor that we look at is the probability that someone's going to change careers. And that's something that we all have to be kind of aware of coming out of the pandemic from a data standpoint. Our data that when we try to come up with models to identify burnout or reasons why someone might leave a career are based off of about 10 years worth of information collected nationally. And the pandemic has started to show up in that data, but it'll still probably years and years for us to actually get a sense of whether or not the pandemic will have directly related to the rate in which our nurses and our frontline staff actually leave the healthcare sector. So that's still going to be a question that we're going to be checking on for several cycles of these projections.
Jason, we have a question in the chat.
Yeah.
How do you differentiate between practitioner and support?
Yeah, so that's a great question. The structure in the way in which we look at detailed occupations comes from a national taxonomy list that's managed by the U.S. Bureau of Labor Statistics and the Office of Management and Budget, and it's effectively over 840 detailed occupations spread out across 22 broad occupation groups. Two of those occupation groups are healthcare practitioners and diagnosticians. And then we have another group called healthcare support workers. So I think broadly speaking, some of this is an expectation of education attainment and skill level. Some of this is based off of just sort of the general nature of where people move from one career to the next, that they've bucketed these careers into. So practitioners like your physicians, physician's assistants, psychiatrists on the behavioral health side, as well as registered nurses, nurse practitioners, those would fall into our practitioner and diagnostician groups. If I was a respiratory therapy aide or an assistant, or some other support worker like CNA certified nursing assistant, that would be a support occupation. So that's broadly speaking what the two different occupation groups are. Does that help clarify that a little bit?
Yes, thank you, Jason.
Good. Let's go ahead and head to the next slide. So as we were speaking broadly about large occupation groups, we can drill down to specific detailed occupations. And looking at the occupational projections and the numbers for each detailed occupation, much of this is driven by the sheer size of these occupations. Our registered nurses, home health aides, and personal care aides, they're some of the largest occupations we have in healthcare. There's also that narrative, especially around home health aides and personal care aides, or those that are more likely to be working in nursing homes and assisted living homes, where we're expecting employment to kind of bounce back in that sector a little bit more than we've seen through the pandemic. And so for occupations like the home health aide and personal care aide, we're expecting nearly 7,000 job openings in these careers annually over the next 10 years. Registered nurses, that's close to 3,000 job openings that we expect to be filled essentially by newly trained, newly licensed registered nurses entering the system for the first time. And so that puts a little bit of context in terms of where we think the demand is. And obviously with business cycles, we see the issues that hospital systems in Oregon are going through. Consolidations may affect, at least within the business cycle, how employment trends go. But we think that overall, the long-term trend is going to sort of drive these numbers. So there's a business cycle going on underneath on an annual basis, but overall, that's sort of where we see the annual trend going for these occupations. Let's go ahead to the next slide. So not every occupation and job opening is going to be the same. It's not like the delivery of care that a registered nurse provides. Because we have only a limited number of occupations to work with, we're not going to see the nuance of all the specializations that are going to be in demand in terms of the shift of specific hospital specializations. We're just going to see the demand for registered nurses increase, but maybe not necessarily emergency room nurses or surgical nurses. That information we don't necessarily have detail for. But we do have some sense is that there are observable differences in what specific occupations are doing in different clinical settings and providing different care in those different settings. And we could see kind of basically as a proxy for this, the wage ranges paid by different healthcare settings here in Oregon. What we have here is information from a national survey that we actually conduct on behalf of the U.S. Bureau of Labor Statistics here in Oregon to collect occupation wage information for those over 840 different careers. And so what you see here is the wage ranges, the percentiles ranging from 10th to 25th, kind of your entry level wages, to your 75th to 90th percentile, your experienced, highly specialized, highly skilled workers in each setting across Oregon. And for something like hospitals, which drive the typical average wage, it's the largest share of registered nursing jobs are found in hospitals. They pay some of the highest wages if we compare that to other settings such as nursing homes and assisted living. There's been a lot of attention through the pandemic around travel nurses, and we see here that there is an observable difference in what's called employment services. Those would be the temporary or travel nurse agencies that would be paying and hiring those travel nurses to be working in different settings. So we see a wide dynamic that's going on. This can indicate specialization. This can indicate education attainment requirements might be different in different settings. Licensing for registered nurses only says an associate's degree, but we know that the vast majority of registered nurses here in Oregon have at minimum a bachelor's degree, and that in some settings like hospitals, the vast majority of those positions require typically a bachelor's degree. So there is a difference in the types of wages and the types of requirements in some of these settings, and we see that. So I want to just highlight that not all these job openings are created the same, and that adds to the complexity and challenges of filling positions as we go through the next decade. Let's go ahead to the next slide. So one of the ways in which we can look at the healthcare workforce, broadly speaking, is what type of jobs, those detailed occupations are being posted out there. What type of jobs do we see currently in the workforce? And based off of job postings, both through national job search services as well as the Oregon Employment Department, what are employers asking as the minimum education requirement? What is the minimum at which my resume can be submitted? And the healthcare sector is a highly talented, highly skilled workforce where the majority of the workers are possessing some form of education beyond a high school degree, some form of post-secondary education, well above the statewide average for all workers. That means that we're more exposed from a healthcare perspective to things like the bottlenecking of post-secondary institutions. We have a question here. Rebecca, could you tell me what that question was? It just disappeared on me here.
Yeah, no problem. It says, is the RN sector analysis based on RN license possession or based on job requirement, including RN?
Yeah, so that's a great question. So the previous slide when we were showing wages comes from looking at jobs reported by employers. So effectively, we go to the hospital, the clinic, the nursing home, and say, what type of jobs, what type of workers do you have? And they say, I have a registered nurse. And so it's the employer telling us specifically what job that they have. We assume that they're properly licensed, and so we expect that. But typically, from a number standpoint, we typically see fewer jobs than the number of licensed nurses. We would like to see at least an ample supply of licensed workers able to do the job, so that's in the right direction. But that's the source of information. So it might be different in terms of the overall analysis you might hear from the Oregon Nursing Association that has a research wing also, because they do a lot of fantastic work looking at licensing and licensing related analysis. So there's a slight difference in the source of information
there. Okay, Jason, we had a couple more questions. And someone wanted to also look back at the color coding on the previous slide.
Sure. Yeah, so the color codings represent the wage range percentile. So when we publish wage information, we basically are trying to describe about 80% of the workforce that's been reported to us through these national wage surveys. And so the lower section, say for instance, the lightest shade of orange on the left between the 10th and 15th percentile. So that's basically saying about 15% of workers earn between the 10th and the 25th percentile. And so each of those color-coded regions are essentially a group of workers that are working within that wage range. So for the 35 or so thousand registered nurses, you get a certain percentage with each one of these groups.
Thanks, Jason. And then there's another question. Does post-secondary reflect certificate programs, or is it just associate degrees?
Sure. If we head to the next slide, going back to the education attainment, this is typically based off of um, uh, an analysis of looking at certificates, but basically looking for the most common requirement. So in the case for something like registered nurses, we know that the licensing requirement is an associate's degree, but the vast majority of job postings we see require a bachelor's degree. And again, that's driven mostly by those hospitals. So it kind of feeds into that loop that the expectation would be a bachelor's degree. And so we assign that broadly to that occupation. There can be some nuances, and that's one of the challenges when we kind of have these buckets that we're working with, is we can't always capture a BSN that is also having a surgical nursing certification or credential. They kind of get lumped into the same group of occupations. And it looks like Gail's already covering the employment services. That's exactly right. It's trying to get a sense of where temporary staffing agencies would be employing registered nurses. We generally associate that with travel nurse agencies. This kind of the
Thanks,
group.
Jason.
Sure. Now, so this is from the employer side, what the requirement is to get that job. But as I love to tell students, very rarely is it the case that doing the bare minimum in life it provides a degree of certitude and certainty of success. So if we head to the next slide, we actually have a much more educated workforce than we necessarily require. The healthcare sector is certainly an example of this, where over 80% of the workforce has some form of post-secondary education. Now, looking at the minimum education requirements on those job postings, that wasn't the case. But when we look at actually the quality of care being provided, this is the dynamics of what's going on within healthcare. The vast majority is much more educated than just simply what's on the job application and resume. The other aspect I want to highlight here is that we do see sector differences in the makeup of educational attainment. I don't think that that's too much of a surprise when we talk about nursing home and assisted care facilities and hospitals. The thing I would highlight, though, is that if we have, as a state, from an diversity, equity, and inclusion goal, that our healthcare providers are reflective or representative of the communities that they serve, that distribution is also slightly different in the sense that we look at it. So if we look at the share of registered nurses that are something other than white, not our non-white populations, whether it's African American, Asian, Hispanic, a larger share of those are found with an associate's degree and than their white counterparts, which means that if you think about the setting and the wage distributions we saw earlier between who's paying more than not, that directly ties to some of the estimates we sometimes see when it comes to registered nurses who are African American making less than their white counterparts. It feeds into whether or not they can get access to working in hospitals and other settings. So that's something just to be aware of, that we do see differences in who's performing this work within these settings. Can you comment on the data is not showing behavioral health workforce shortages? So I think that's a fantastic question about behavioral health. In terms of specific shortages, some aspects of that may be related to the occupation groups we were sorting for. So as I said, with healthcare support occupations and healthcare practitioners, our behavioral support occupations are found in a different area. I think our analysis and pulling data here was specifically for the healthcare practitioners and healthcare support workers. I'm getting nods from Gail, so I'm going to just keep saying that that's the case. Is that right, Gail?
Yeah, I mean, I think we're not the data isn't showing shortages or non-shortages necessarily. We're not calling it out as a shortage or non-shortage in the way that we're looking at this. In what I was showing earlier, we are seeing demand for several behavioral health occupations for jobs in those. So we're seeing demand. And that's what I was talking about when I was saying that we're seeing kind of deeper levels of demand than just kind of those three big occupations that come up. I think that one of the things that tends to happen in behavioral health, from my not as deep understanding as anybody else in the room, I'm sure, is that they tend to not be as massive of an occupation as registered nurse, and therefore don't always come to the top of these lists. But that doesn't mean that there isn't true difficulty filling the positions that are out there in behavioral health, or that there, aren't necessarily shortages in that, that if every single behavioral health professional that was looking for a job right now would fit into one of those vacancies, that there wouldn't still be empty vacancies. So that could very much be the case, but that's not that we don't have that complete of a picture to paint with the data that we have available here.
And Anna had a question about the diverse data. That was, I apologize, what we call napkin math. There's a program called the American Community Survey that collects demographic information and over 5 years or so. And it allows us to drill down into some of the diversity questions and demographic questions about our workforce and different jobs. That number came off of a previous analysis that I did. So I can certainly try and look that back up and submit that as some additional information for the committee later on. So it's a customized analysis. There's not a particular publication to point to, but I can certainly get that to the committee. Let's go ahead and head to the next slide. I know we're getting towards the end of our hour. So one of the things that I kind of wanted to land our discussion on, again, because I want to emphasize context, right? So whether it's behavioral health jobs with projected growth at 15% or healthcare at 17%, part of the question that we constantly get and have a very difficult time answering, because we kind of cover the demand side of this supply and demand question, is how are we filling these jobs locally? How are we recruiting talent coming in from the state? And it's kind of a question, how do we hold on to this workforce, especially as we deal with the demands of an aging workforce and people retiring? And it comes down to kind of the 3 R's. It's a matter of recruiting the talent that's coming out of Oregon. It's a matter of being able to bring in and relocate people from out of state, which has been an important factor in the healthcare sector, and bringing talented people from elsewhere into Oregon to fill those jobs, as well as retention and addressing those demographic shifts, or looking out for shifts in the turnover or burnout rate for frontline workers, as we've seen, as we kind of monitor what has happened out of the pandemic. One of the sources of information that we have access to is from the U.S. Department of Education's National Center for Education Statistics. It's a national clearinghouse of any public or private institution that receives federal financial aid, and they have to report people coming out of their institutions. It's one of our primary sources to get a sense of how many completers, whether it's nursing degrees or other programs related to healthcare, are exiting Oregon institutions. Now, the chart here that you see have 3 lines. The thickest line is comparing employment. So this is basically the trend in Oregon's employment, private and public, over the past 10 or so years, growing nearly 26%, and how that compares to the completer rate of degrees in healthcare broadly. That's the yellow line here. And then the other blue line is registered nursing programs. Now, I know it can be surprising to see how flat that story is, right, compared to employment. But I want to put this into a longer term perspective because I was able to look at some other sources on this. Since 2002, over the past 20 years, healthcare sector as a whole has grown somewhere around 60%. That's when we look at the number of completers coming out of Oregon private and public institutions, we typically see completers, at least through 2022, the 2021-2022 school year, they've increased roughly about 60%. What's kind of bucking the trend here is that we had a peak just after the Great Recession, where basically people who couldn't find work fled into post-secondary education by any means necessary. And that may have been kind of a high point or even more than we necessarily needed at that time. But the workforce and the demand from the workforce has caught up effectively. And so that's what we're seeing here. The other thing I'd highlight is that while we have seen Oregon post-secondary education related to healthcare increase by about 60% in terms of the number of completers, that nationwide number is close to doubled compared to where it was in 2002. So we do have some constraints here. And from a workforce and human resource standpoint, one of the important things that we have to be aware of, which can impact things like what I have to pay somebody to come here, is the fact that in-migration has slowed, right? So if that's fueling our ability to draw talent, the other levers that we have access to, either through wages or benefits, has to do something in order to bring that talent pool in. And so I just wanted to close to highlight that while we're showing demand information, it's important to put that into context to the pipeline that's filling those projected job openings in the years to come. And so I know we're over time, so I want to respect folks' time. I think we'll be glad to stay on to answer questions, but
Jason, Gail, thank you so much for presenting this morning. Fabulous information. We do have a couple questions in the chat. If you don't mind answering these last two remaining questions.
Sure.
One is it possible to show any regional variation? For example, I assume that rural areas would have more challenge than urban areas. And then also wanting to know more about where workers are coming into jobs from. Are they coming from other places, being quote unquote imported, or are they upskilling within an organization?
Okay, I will take the following people's wage records and job vacancy challenges portion of that, and then let Jason fill in the rest.
Oh, thanks for taking the hard one. I appreciate it.
So in terms of where workers come into jobs from, one of the data tools that we have available to us is workers or employers that whose workers are covered by unemployment insurance, meaning you have to pay unemployment insurance taxes. So that if your workers lose their jobs through no fault of their own, they get unemployment insurance benefits. So those employers are required to report to us every quarter the identification number, the name, the wages, and the number of hours worked for each of their payroll employees. And so we can do, it's a custom analysis. It's not just kind of sitting there ready for us. We have one of our colleagues who's dedicated to looking at, like, where did they go or where did they come from? The healthcare workforce. So you can see where they come into, like, oh, they used to work in a childcare setting while they were going to school or something like that. And then they came into a healthcare job after that completion or something like that. So we can see that it's got limitations and that we can generally, without there being some sort of great interstate and federal government contracting type situation that takes a very long time, we can only see within our own state. So we can only see people, like if somebody comes into healthcare, but they were, working in South Carolina before that, we only just know that they showed up. We don't know where they came from. So there's limitations to that. And when somebody leaves, we don't know if they left to go take a nursing job in Washington. We don't know if they retired. We just know, or if they upskill within the same, they go from being a CNA to being a nurse, a registered nurse in the same organization. All we see is that they're continuously employed by that same employer. We don't see that their job changed. So there's real limitations to our ability to be able to track like that. In terms of regional variation, we do have, and on our website, qualityinfo.org, I would direct people to the data section and the job vacancy survey results. We do have annually a breakout of occupations with the largest number of job vacancies. And I think it also may have the largest number of hard to fill job vacancies. And you'll see, I looked up quickly Eastern Oregon on the side, that in the top 10 occupations with difficult to fill vacancies, that personal care aides and registered nurses show up in Eastern Oregon as well. And I'm sure that they do across other areas too. So we can take a look at that comparatively as well if somebody wants to take a deeper look into it.
Yeah, and just to piggyback off of that, when we develop the industry and occupational projections, we do regionalize that work for 9 workforce areas across the state. For areas as large as the East Cascades region, we try to break that out. So, for instance, with Eastern Oregon, Morrow and Umatilla County is kind of treated as its own region compared to the other 6 counties in the eastern side, just because they're pretty significantly different in terms of economic activity. There is a question in here about the last slide and the data about for-profit institutions. That's a fantastic question. And the focus on that analysis is any institution that receives federal financial aid. Most of our private vocational career schools, and I think that's what you're speaking to, which a lot of medical assistants and phlebotomists and other entry-level healthcare positions are trained through, that is a lot of those programs do not, and so we don't necessarily see that show up in the data. That's some of that is eventually going to be available through the Higher Education Coordinating Commission that administers and oversees those organizations, but unfortunately, that additional part of the analysis is not available right now.
Well, thank you, Jason and Gail. I just want to let everyone know that your contact information is on the last slide. Also, there's the ability to sign up for the latest workforce and economic research updates at www.qualityinfo.org/subscribe. Thank you so much for presenting today. It was so informative. Just can't thank you enough for being with us and giving your time and expertise.
It's our pleasure.
And thank you to everyone who joined us. What a fabulous presentation and turnout this morning. Tune in for our next educational webinar in August. More details to come. And everybody have a fabulous morning. Thank you.